and welcome to this segment of Diagnostics. I am your host, Regina Lee. Today we focus on end-stage renal disease and the Native American population. Diabetes has been a major cause of end-stage renal disease in Native Americans. In fact, 69% of new cases of end-stage renal disease can be attributed to diabetes. Now, the Indian Health Service has made a high priority on diet education and other factors to help reduce the incidence of diabetes. And in fact, it has been steadily and rapidly reducing to about 54% over the span of 17 years. So much that in 2013, the incidence dropped so much to be as equal as those of white Americans. Joining us today is a newly diagnosed end-stage renal disease patient from our dialysis clinic. Hello, welcome to the show. Please have a seat. Well, how are you doing today?
I'm doing good.
Welcome to Diagnostics. Would you like to introduce yourself to our audience?
Yes, my name is Samuel Ness.
Well, welcome to the show. And I see that your family is here with you today.
That's right. I brought my mom with me and my brother and sister.
I'm very glad to hear that they're here with you today because they too need to listen about end-stage renal disease and how this is going to affect you. End-stage renal disease is a chronic illness and there is irreversible damage to the kidneys. Do you understand why you need hemodialysis?
Well, I assume it's because my kidneys aren't working.
That's right. They are not working the way that they should in order to filter your blood and clean you of all the toxins. In chronic renal disease, there's different treatments available. There's hemodialysis, there's peritoneal dialysis, and there is also kidney transplant. So to talk to you a little bit more about this, I'm going to show you a video where it explains exactly what goes on in the kidney. Is that okay?
Yes.
In this video, Samuel, it shows where blood enters the kidneys through the renal artery, where it becomes filtered in the kidney, and then the cleaned blood returns to the body through the renal veins. The excess fluid and toxins leave the kidneys through the ureters, where it collects in the bladder, and then it is expelled from the body. In the kidneys, each lobule contains millions of nephrons. Each nephron contains a glomerulus, where the actual filtration occurs in the podocytes. Blood passes through small arterioles, which passes through the Bowman's capsule, where it meets the glomerulus. Toxins, small molecules, and other electrolytes pass through a permeable membrane from the blood to the glomerulus, and then the filtrate collects in the tubules, where further uptake and release of molecules occurs. So let me show you what happens with diabetic nephropathy. What occurs is the membrane becomes thickened, and so with time the glucose that is passing through the blood, there's an excess glucose or sugar, and so those attach to protein, and because there's thickening of the membrane, these areas enlarge, which allows the passage of glucose and protein through the membrane. There is also a thickening of the arteries, or the efferent arterioles. And when that occurs, there's too much constriction in the glomerulus, which doesn't allow filtration to occur. So this is where kidney damage, the degree of kidney damage can be determined, is by the amount of protein that is entering into the urine. Because usually the proteins are not supposed to go through, and when there is damage, that is why the proteins are able to pass through. And another way that doctors are able to know if a patient has kidney disease is the glomerular filtration rate, or the GFR. And that tells the physicians how fast your kidneys are actually filtering out the toxins. So it is during this phase of kidney disease that ACE inhibitors, which are medications that act directly on the efferent arteriole to cause vasodilation. And also other medications for diabetes are introduced, if not already taken, to help reduce the glucose levels in the blood. Now in your case, Samuel, you should continue to take your ACE inhibitors and continue to control your sugar levels. So Samuel, the other two medications that are required and actually are chronic for kidney patients, for dialysis patients, is Epogen and Hectorol. Now, Epogen is a medication that is given during your dialysis treatment, and it is given because the kidneys are not able to produce the hormone to make your body make more blood. So anemia is very common in kidney failure patients, and so Epogen, what it does, it goes to the bone marrow and causes your body to make more blood because the kidneys are no longer making that function. And the Hectorol is actually an activated form of vitamin D. Usually the kidneys are able to transform inactivated vitamin D into activated vitamin D, and what that helps with is the use of calcium. Calcium cannot be used by the body if vitamin D is not activated. And so usually what happens is the parathyroid hormone is released from the parathyroid gland, which is what causes the bones to release calcium into the blood, because the body is always trying to create a balance. And so this damages the bones because the bones then become brittle. So Hectorol is given, and that's going to help your bones not release the calcium. And also with kidney failure, the kidneys are not able to release phosphorus, and that can also harm your bones. It actually creates calcifications in your arteries, in your heart. It can cause calcifications in the bones themselves. And so it is very important for you to monitor your phosphorus intake, and I have some handouts here for you that will teach you what foods are to be avoided and what foods you can have. And it is overwhelming, all this information, but with time you will understand what foods are okay and what foods are not. And another medication that is very important is Foslo, or calcium acetate, and these are phosphorus binders. Because the foods that we eat contain phosphorus, you should take these medications with food, not before, not after, because in the body, in the gut, it binds to the phosphorus so that your body can release or get rid of the extra phosphorus. Speaking of food, another electrolyte that is high in your body is going to be potassium. Potassium is another electrolyte that is released in the urine, and so when the kidneys aren't functioning the way they should, the blood has high levels of potassium. So the only way we can control that is with hemodialysis and with you lowering the amount of potassium foods that you eat, which I will give you some handouts on that as well. And it's very important not to have high levels of potassium because this can cause arrhythmias, and it can even cause heart attacks or even death. So we will be monitoring your blood levels because everybody is different. It doesn't mean that you're going to be like every other patient that we see at the dialysis clinic. And we will go by those labs so that we can tell you what foods are allowed and what foods are not. And we will set up a meeting with you and the dietitian. We also have a social worker that helps out. A lot of times patients with chronic kidney disease have depression because it's not an easy disease. It's chronic, and so a lot of patients do become depressed. But there is hope because there is kidney transplantation. So Samuel, here are some of the handouts, and I would like for you to take a look at them and let me know is there anything on there that you notice that would be a problem for you?
Well, my mom actually makes a lot of food with blue cornmeal.
Oh, interesting.
So would this be a problem?
Actually, it would be a problem. You would probably have to reduce the amount that you're eating because anything that contains cornmeal in it will have high phosphorus. I do notice that in Native Americans or in your culture, phosphorus is usually not high. But like I said, we will look at your blood levels and find out where you're at with that.
Okay.
And another important thing with phosphorus is dairy products. Now, what I have been told is that dairy is not very common, so it shouldn't create a problem with you with phosphorus. Is this true in your case?
Right. We don't use very many dairy products in my house.
Okay. I can't think of anything else that would be a problem with your meals. Have you been a diabetic for a long time?
Well, I was diagnosed when I was 22, so about 7 years.
So how do you feel about your diabetes right now?
Well, it's been a bit difficult to control, yes.
Okay, so just keep in mind we will be checking for that too in our lab work. And like I said, the problem with high glucose levels is that that's what causes the kidney damage, as I showed you on the video. So it's very important for you to control the blood glucose continue to take your medications the way you should, the way the doctors prescribed. Now let me ask you, do you have any questions right now regarding end-stage renal disease?
Well, I guess I'd like to know how I could obtain a kidney transplant.
Yes, I understand that in your culture, harmony is very important, or it's rooted into your culture. So I can see why a kidney transplant would be, important to you, because in the end, the kidneys, that's what they do, is they keep in balance your body with the nutrients and the electrolytes your body should have. So what we will do is we will have the social worker start the application for you, and usually it takes about 3 to 5 years before kidney transplant can be possible. It is a long process, so just be patient, try to be patient. But you're fairly young, so that's a good indicator that you might receive a transplant pretty soon. I just want to emphasize the importance of your dialysis treatments, that you have to be there on time and you cannot miss your dialysis treatments. So can you think of any way that you can try to keep your appointments or try to stay on top of your medications?
Well, I could always set up an alarm or a reminder on my phone to remind me when to take my medication and when my dialysis treatments are.
You can also have a family member call you, remind you.
Okay.
But just remember, it's very important to keep every treatment. And I also wanted to ask, is there any religious rituals that you usually have in your culture? Because if you do, I want you to know that they're not contraindicated as long as it doesn't interfere with your dialysis treatment, or your medication regimen.
Well, yes, we actually have the Blessings Way ceremony, which it's very important to me and my family.
Interesting. So what is it for?
It's a healing ritual.
Okay. Yes, I understand how that can make a big impact in your life, because you have to keep a positive outlook in your life. So if that's what's going to help you, then that's great for you to do that. Okay, well, thank you so much for being with us. And I have really enjoyed our talk. And I thank you for being a part of our show today and allowing our audience to listen in to this initial education for you. Now, I know this is overwhelming, it's a lot to learn, but slowly you will understand it all, and hopefully, you can get your kidney transplant soon.
Okay.
Okay, well, thank you so much for being with us today, and on our next education session, we'll be talking more about dialysis and how it actually works. Thank you, and have a good night.